introduce you. Doctor of Osteopathy and Family Medicine physician at UConn Health. Thanks for talking about platelet-rich plasma or PRP therapy. We're going to find out who, what, where, when, and why. He has said it's perfect for active adults and athletes, those seeking natural alternatives, and anyone wanting faster, smarter recovery options. That's the summary, and I'll let you take away from there. Hopefully we are recording.
We'll find out.
We'll find out.
So thanks for coming by. We'll have a pretty small intimate group. So the who, what, where, when, and why. So kind of going through it, we're going to have to know what PRP is, what we know, the future directions, what it can be used for, how helpful it is, and then when we compare it to other treatments and whatnot. So what we know, a lot of what we know about PRP is originally started in the laboratory. And what we've learned is the function of the platelet, what it holds, and how we can utilize it. So when we take bench research, it can get pretty complicated pretty fast. You have all these different sort of things. We've learned about different tendinopathies, what causes it, all the different cellular signaling, what happens when those signals go awry, how we can modulate them, what the platelet does, but all this becomes really good. So we're trying to break it down a little bit better. This is not me in medical school, but it might as well have been. So let's get into it. What is platelet-rich plasma, also known as PRP for short? So platelet-rich plasma is concentrated platelets, which are in your blood. So what we do is we take your blood, we spin it down with a centrifuge, which is then going to separate the layers of blood. There are 3 different layers of blood. On the top is the plasma, that's the least dense. So that would be your vinegar compared to your water, which are the red blood cells on the bottom. In between that is the buffy coat. That is really what we're after in platelet-rich plasma. The PRP is what and the buffy coat is really what contains the structures, the cells, the scaffolding to really help repair and remodel. Once we extract that, we then put it into area of concern. In this picture, looks like it's in the rotator cuff. So what's so special about that buffy coat that we really care about it? Well, it's about 1 to 2% of the blood that you draw. During the centrifugation, again, kind of going off the technology, it spins anywhere from 8,000 RPM, 15,000 RPM. It has a wide range. Now, when we spin it out, we compact the red blood cells down at the bottom. And so we throw that part out. That part can be very caustic. It can be painful. That's the part that hurts when you have a bruise, that breakdown. In the plasma can be different types of proteins and whatnot. But in that buffy coat, again, are the platelets. The platelets are what primarily responsible for forming clots. And in the other half of that is the immune system, which is, as you know, responsible for fighting infection, disease, etc. So why are platelets so special? Is because they carry these packages, also known as vesicles. And within those packages are different chemicals and compounds that help recruit cells in the body to help repair and remodel. Now, the different functions of those chemicals have to do with recruitment of the immune system, right? If you think about cutting your hand on a paper cut, well, there's now little pieces of paper fibers that are too small to see. On that are also different bacteria. And so we need that immune system to come by and get rid of that debris, get rid of that possible bacteria and that possible infection. In addition, it lays down scaffolding. People know that they get scabs, right? So it lays down scaffolding. And then it calls, after that, it calls the cells to help repair the tissue. And that's why you can heal from a scab or from a paper cut. There's a ton of functions of the platelets, but primarily what we're gonna again go over today and what we're looking at in PRP is this side. And that has to, I mean, it's not easy to see from maybe where you are, but it has to do with pretty much everything I just talked about is that remodeling sort of process. So what conditions does it treat? This is a busy slide, but the long and the short of it is it treats a lot of different conditions. You have a diagram or a pictogram over there. The only thing that this pictogram doesn't show is that the hip as well, it does treat the hip and other muscles. When we look at the knee, osteoarthritis, PRP has been shown to be an effective treatment for osteoarthritis. And when you compare it head to head with steroid, it actually can be beneficial over steroid, especially when coupled with physical therapy. We know that from the laboratory studies that we've seen that you have to teach these cells that are laid down with PRP, you have to teach them to become the surrounding cells around it. So if you put PRP into a tendon, it's going to learn to become a tendon through physical therapy. And again, that's that first really complicated slide that is way too detailed for this, but we have to teach it with the help of physical therapy. So in conjunction with physical therapy, PRP has been very helpful for osteoarthritis. When looking at different tendon pathology or tendinopathies, such as lateral epicondylitis, patellar tendinitis, Achilles tendinitis, it has been as effective without the harmful side effect potentials of steroid. When combining it with PRP, it is more effective, again. And of course, we have our levels of physical therapists and chiropractors in our team here as well. When you look at things like rotator cuffs, that's another very common thing that we see in the world of sports medicine. You needed to golf, you need to throw a ball, you needed to swim, you needed to run. Your rotator cuff is at risk of injury quite often. But when we look at that, it's been a complementary and a beneficial medicine, if you want to call it a medicine, product that we can use, again, to facilitate recovery. When you combine it with PT, it actually has great effects. For meniscus tears, it hasn't been very well studied yet because meniscus tears, they bear a lot of weight, there's a lot of grinding, but we found that in the surgical realm, when you couple it with suturing, it is a great option. Now, for a lot of people that don't want to go under the knife, and I don't blame them, I don't either. So it is also another option for people with meniscus tears, especially when you have arthritis, right? We have limited resources. If you don't have a hammer with you, you may use a screwdriver as a hammer, so to speak. Not the best analogy, but what I'm trying to say is that we don't have all tools as we would for someone with, say, for example, high blood pressure. There's only so much that we have. So this could be a great option for patients as well, for multiple different conditions, but see, these are some of the most common ones. So this is kind of what we were talking about before. Why are the results of PRP not the most consistent?
Go on.
All right.
Next.
Okay.
Remind me.
City. Yeah. Are you here for the presentation?
Yes, yeah, do you mind if I snag a few?
Yeah.
Sorry.
Yeah. So not all PRP is the same, right? So if we take a very healthy, say for example, 21-year-old at UConn basketball player who has pretty much a private chef, physical therapist around them, they're healthy, they're young, compared to say someone who's 80, been smoking all their life, has diabetes, eats Cane's chicken for dinner every night. Those are two very different blood products. And so you're not going to have the same results. One is going to be much more inflammatory. The other one is not much more inflammatory. And so that can play a factor, right? This picture here shows what blood will look like based on when you eat and when. We've actually seen people who eat McDonald's every day, When you spin their blood down, they actually have a layer of fat in their blood. And it's really gross and impressive because that's what circulates around in the blood. And that it can just cling to all the arteries, never mind the joints and the nerves and everything else. Kind of going along the lines of each person is different. You know, we have different amounts of platelets in our blood. So my blood is different than your blood, which is different than your blood, which is different than the next, and the next, and the next. In addition, our platelets change from minute to minute, hour to hour, month to month, season to season. For example, you and I will not be giving birth, but maybe someone else in this room will. And so therefore the platelets to clot after birth change, right? So just that little piece there, something you don't really think about, matters. It's a big difference. It's a very big difference. Especially when you're talking on the order of billions, millions, etc. Yeah, so more platelets are better, exactly. So someone who, say, for example, has a bleeding disorder, they can't clot. If that's the reason because they have low platelets, may not do as well. Medications we take. Some people who have serious heart conditions, they may take antiplatelet medication. Well, guess what? If you're on antiplatelet medication, PRP probably won't be the best for you. Or may not just be as effective. Genetic differences, you know, from schools and sports and stuff, we can think there are always those athletes and those teammates that are always injured, and then some other people, they just weren't injured. And that has to do with our genetics and our tendons, our genetics and whatnot. So that plays a role that, again, is very hard to understand. Differentiation support systems. Physical therapists, right? I always like to tell us, a lot of surgeons hate this. The surgeon is as good as the physical therapist they're working with. Of course, they hate that naturally, but the truth is what you put in is what you get out. The team around for you does that. And here's a phenomenal team, multidisciplinary team that really takes interest in a lot of their athletes' well-being. Mood and outlook. This one cannot be underestimated enough. Is that the right? English is not my forte. I'm underestimated enough. You know, we know that pain affects mood and mood affects pain, and they're very intertwined. And the psychology of pain is very complex. And so having a positive mindset and a positive mood, difficult when you're in pain. However, it does make a big deal. Activity level and cognitive function, again, if there's something else going on with the brain, there's likely something else going on with the blood, and we find that there's this correlation, not so much causation. But these are the scratching the surface of why not all PRP is the same.
So let's say I get hurt again.
Yeah.
Like, if I tell her I'm doing this, does she do something different?
Great question. So yes and no. The yes part of that is that when we inject PRP, we're gonna have to kind of let things settle in first. So you'll be on a resting period for 1 to 2 weeks. Then we do range of motion stuff, as opposed to if we haven't done it, we can jump into a lot of things without the rest. Depending on what's going on and everything else, right? The other part is when kind of getting to the technologies, I put this in the slide here, but when we have the technology to separate the different components of that buffy coat, remember we talked about in the buffy coat, there's the white cells and the platelets. The white blood cells, their job is to seek and destroy foreign objects and damaged objects, right? So if your tendon is injured, I'm going to cause a lot of inflammation and put more what we call leukocytes, white blood cells, into that area, causing destruction of what and chewing up that bad disease tendon to then lay down more scaffolding and repair the tendon later. Well, in the world of osteoarthritis, we already have a ton of inflammation and destruction, right? We don't need any more. So with certain technologies, we can remove some of those white blood cells. So we only have the anti-inflammatory and the pain modulators to help with that as well. You know, in some of these commercials for osteoarthritis, you'll hear things like regrow your cartilage. I'm gonna tell you now, it does not regrow cartilage. I'm not gonna sell you something, right? I'm not going to try. This is just for your information. It does not regrow cartilage, but it helps with pain modulation and it's inflammatory, so you can keep moving, so you can sign up for OR and continue to enjoy the life.
But-
Yeah.
So, pardon, maybe a next question, I thought, but the white blood cells are helpful, but in a moment ago, it sounds like you're saying you remove white blood cells before, so what, but that doesn't compute to my.
Right.
Yeah,
So in the blood, there's three different layers. There's the plasma, the red blood cells, and the buffy coat.
and are they, so the plasma and the red blood cells and the white blood cells, are they all mixed together in the blood?
Yes, right now they're all flowing together.
Okay.
However, what we do is that we take your blood, we extract it, we spin it down, and based on the density, kind of like oil and vinegar, they'll separate out. And so the red blood cells will go to the bottom, the plasma will go up top, and the middle layer, which is called the buffy coat, houses the platelets and the immune system.
Those white blood cells.
Those are the white blood cells, yes. So we take that part out, and then based on the different technologies, we can then separate if we want the platelets with the immune system or without the immune system.
Oh, wow.
And based on the condition that you are telling me about, I can then make that decision, what's best for you.
So like occasionally I've donated blood. So it's possible, so credit from home, but you can donate blood in general, but you can also donate platelets, right?
You can donate platelets and they can donate plasma. However, you can't pull out one or the other. So what they do is they spin it. And based on the density, that's how they separate it into platelets, plasma, or whole blood.
Okay, so is that why it's like so far I haven't donated platelets because I don't have the idea of like basically if you donate platelets, the blood's exit your body, but then they're circulating back into your body.
After
Like,
centrifuge.
something about I'd probably not have like after it's passed through, however clean the machines are, you know what I mean?
Yeah.
I haven't taken that leap yet, but
Yeah.
but that is that why there's a distinction between a whole blood donation and a platelet donation?
Exactly.
Okay.
That is exactly it.
Wow.
And in the world of trauma, surgery, sometimes we need those extra platelets for those people so they can form a clot. Or people who have blood disorders that don't have enough platelets,
Okay.
we can give to them so they don't exsanguinate or bleed out.
Okay, thank you.
Yeah, of course. So again, based on the technologies, we can separate that out. And so finding a place and kind of understanding the technology may be important for you as well. So say this is something you want to do, you want to give yourself the best chance. How do you optimize your blood? Well, Hippocrates over 2,000 years ago said, let medicine be your food and food be your medicine. And that still rings true today. You know, we can really make an impact in our life with the foods we eat, our activity levels, and everything else. So say, for example, someone is anemic, we encourage them to eat iron-rich foods. Where can that be? Beans, meats, etc. Now, if someone's vegetarian, there's tons of iron-rich foods. We know that spinach, broccoli, etc. B12 is important. That's another one for platelet function. B6 is another one that's important, right? In New England, we need a lot of vitamin D because we don't get it all from the sun. Where can you get vitamin D? Mushrooms, that's another great source as well. Another one is exercise. PRP depends on the number of platelets that you have, right? Platelets are a response of stress. So that stress could be trauma, you cut your hand, infection, there's something else going on, you have the blood circulating, et cetera, et cetera. So obviously you shouldn't cause trauma or bleeding, use up your platelets, they're not circulating your blood, but one thing you can do is exercise. 30 minutes of intense exercise in the HIIT program or whatever can temporarily increase your platelet count. Please shower before going to get PRP, and then you can go and your platelets should be elevated. Now, what happened? How do we cause a use of platelets? And what can we do to avoid them dropping down? Inflammatory foods, being in a chronically inflamed state, that can be harmful to the platelets because they're constantly being used up. That includes things like smoking, alcohol use, eating unhealthy habits, being super sedentary and not really moving your body around and whatnot. Anytime there's obviously trauma, bleeding, your body's going to use up the platelets. Contradictory to sort of a birth, actually. You're going to have an increase of platelets so that you can clot. That's obviously not your priority though when you're delivering. And then other things that can cause it are cancers, right? People who get cancers should not get PRP. People who are on antiplatelet medications, right? They're going to affect that. Sometimes different psychiatric meds can actually affect it. Bleeding disorders, recent infection, things like thrombocytopenias for whatever reason, which just means low platelet count is what thrombocytopenia means, and there's multiple different types. And the list goes on and on. So if you do decide to meet with someone about PRP, that individual should be taking a good history of your medical records, medical conditions, the medicines you take. If they don't, buyer beware sort of thing. They should really think about this a bit, which is how people get into trouble. You definitely don't want to be injecting a cancer into a place that there isn't already. So in summary, PRP works by utilizing the body's both inflammatory and anti-inflammatory properties, as well as their healing properties and pain modulation. PRP is an option for people who don't want to undergo surgery or want to try to do something else that's a bit alternative and a little bit more natural, as opposed to injecting medicines. It can help treat multiple different musculoskeletal conditions, anywhere from inside the joint to outside the joint, tendons, and we can even get into muscles. They actually start to use it for facials now as well, called vampire facial. Really scary pictures. PRP is best coupled with physical therapy and a healthy mindset. Again, really thinking about that support system, who's around you, having that network. Living a healthy lifestyle is one of the best ways to increase your platelets more naturally, in a more natural way, excuse me. And then, again, buyer beware, not all PRP is the same, and PRP is not covered by insurance. One of the reasons is because it is your blood, it is not theirs. They don't yet own you and your blood the way we're going. Maybe insurance will, but it is yours, so they can't, what's the word, monetize, thank you. They can't monetize your blood, but they can monetize the patent of the technology, but that's, again, not the drug quote itself.